My name is Kelli Gevas. I'm a gynecologist, women's specialist, obesity medicine specialist with Genesis Healthcare System. So I went to medical school at University of Medicine and Health Sciences, and then moved on to my residency in Obstetrics and Gynecology. Since graduation, I worked in Columbus, where I supervised some of the Ohio State University residents there, and then went on to be a hospitalist and clinic practice obstetrics and gynecologist. Well, prior to becoming a physician in obstetrics and gynecology, I was actually a certified nurse midwife for several years, about 10 years. And at that time, I knew that I didn't quite have the knowledge base or skill set that I wanted to have. And that's when I decided to go to medical school to become an obstetrician and gynecologist. So I knew before I got there that that's what I was going for. I always wanted to be a doctor, but I wanted to be a mom and wife more first. So my journey was a little bit later becoming a physician, but I knew ultimately I would get there, and I did. I had recently been interested in broadening my education and went and became board certified in obesity medicine. I really like gynecology, wanted to practice more in that field, and Genesis is giving me an opportunity to do that, to care for women and to also practice obesity medicine. I'm always excited when I get a patient to come in, or any patient, but especially a new patient that's coming in with a challenging concern. I like to get to know them first as a person, and then I enjoy motivational interviewing to see really what it is that they want to get from this, what their needs really are, and I can learn a lot about a person with that technique. When you do motivational interviewing with a patient, you find out what are important to them, what are their biggest concerns, and how you can, with shared decision-making, make your plan of care for them. And that way you have a better chance of success because you know what they're looking for to get from this. I treat women from puberty into elderly age, menopause. Most of their concerns are cycle-related, fertility issues, menopausal, perimenopausal signs and symptoms. All of those things are treated with a gynecologist. I also will be doing obesity medicine, where I've always taken care of women. Now I'll be taking care of men and women, helping them reach their goals of health. I'll also be treating women who may have irregular bleeding with hysteroscopy in the office, which I'm looking forward to. They won't have to go to the operating room for this procedure with me. I'll give them something to relax them and be able to look right into their uterus in the office and identify if there's concerns, take biopsy samples, etc. So I'm looking forward to that. I also have an ultrasound that I'll be able to use handheld if I need to look into their pelvis for any concerns with cysts on their ovaries or other concerns in the pelvic area. After a long day seeing patients, I do like to come home, spend time with family, see my grandchildren, my children, and have a nice dinner together with them if it's the day of the week that we can.